budget, and the Ministry of Health has been allocated 121.1 billion shillings under the 2021-2022 financial year, a slight increase from the 112 billion shillings it was allocated in the last financial year. However, the National Treasury has come under criticism over the COVID-19 response allocation that critics of the budget term inadequate, considering the amount set aside for procuring vaccines, given the estimates required to vaccinate at least 30% of the population. Here's Gloria Milimo with that report.
The Ministry of Health is among the top 5 ministries that have received a huge share of the 2021-2022 financial year budget allocation. Under the financial year 2021-2022 budget, the ministry has been allocated 121.1 billion shillings, a slight increase from the previous allocation of 112 billion. However, in the wake of the ongoing COVID-19 pandemic, critics of the budget argue that the budget allocation for COVID-19 response is way too little and will lead to over-reliance on donors to help tame the virus. Of the total amount allocated to the ministry, only 14.3 billion shillings has been allocated for COVID-19 vaccines. Critics argue that the allocation will not be enough, considering the cost required to vaccinate at least 30% of the population, which is 34 billion shillings. The Parliamentary Budget Office has also raised concerns on funding of Kenya's biggest mental institution, the Mathare Teaching and Referral Hospital, that has received an allocation of 200 million shillings to help modernize wards and staff houses. It is, however, not all doom and gloom, as some of the winners in the budget include proposed removal of value-added tax VAT on a number of medical equipment, medicine and supplements, which attract a 16% VAT. These include malaria diagnostic kits, orthopedic or fracture appliances, food supplements and other artificial parts of the body, namely pacemakers, but excluding parts and accessories. According to an analysis by KPMG on the Financial Bill 2021, other commodities proposed for exemption are medical ventilators, breathing appliances and gas masks, excluding protective masks having neither mechanical parts nor replaceable filters, but upon approval by the Cabinet Secretary for Health. Also not excluded are treatment and diagnostic or laboratory reagents, needles, urine bags and infant milk. Universal health coverage, on the other hand, which is among the government's Big Four agenda meant to ensure access, affordability and quality of healthcare services, has been allocated 47 billion and 450 million for cancer equipment. Meanwhile, in this financial year 2021-2022, the Ministry of Health will receive 17.31 billion from Global Fund for interventions for malaria, TB and HIV that have over the years been dependent on donor funding. This, even as the country's positivity rate now stands at 9.3% after 624 people tested positive for COVID-19, raising the COVID-19 caseload to 174,285. Gloria Milimo, KTN News.
And apologies for that typo on the graphics there. So let's go back to that story I was talking about earlier, where other East African Community member countries presented their respective national budgets today as well. Rwanda, however, postponed the reading of its budget until later on in the month. And here's Brian George with